Approximately 21% of Canadians will meet the criteria for substance use disorder in their lifetime. Substance use can affect anyone, regardless of age, income, or lifestyle. Hi, I'm Dr. Sarah Brandigampola, psychiatrist at the Ottawa Hospital and lecturer at the University of Ottawa. In this video, I'll discuss substance use disorder, what it is, its causes, common signs, and treatment options. Understanding this condition is the first step to reducing its impact. Substance use disorder is recognized as a medical condition where there are significant changes in the brain that make controlling substance use increasingly difficult. We often have a picture in our minds of what addiction looks like, someone struggling visibly and profoundly, but in reality, it isn't always that clear-cut. The term substance use disorder itself reflects a shift from outdated terms like addiction or substance abuse, recognizing it as a medical condition influenced by significant brain changes. Substance use disorder can affect anyone, regardless of background or lifestyle. What starts as a way to cope with stress or trauma can evolve into something much harder to manage. Substance use disorder is caused by a mix of factors, including trauma, genetics, and environment. Trauma is a common driver, such as abuse, neglect, or the stress of being unhoused. Anxiety and depression can also lead people to use substances to cope with emotional pain. Genetics account for 40 to 60% of the risk, often linked to inherited dopamine levels, which affect impulse control. While having these genes doesn't guarantee the disorder, it can increase susceptibility. Environmental factors like work stress, social pressure, and easy access to substances play a big role. Take alcohol, for example. It's widely normalized, yet current Canadian guidelines suggest that there is no amount that is truly safe. Even one drink a week carries risks, including cancer. Habits like needing a drink after a hard day are often encouraged, but this can be a sign of a deeper substance use issue. With such normalized behaviors, it's crucial to stay mindful of how substances can subtly and significantly affect our well-being. Recognizing the signs of substance use disorder helps identify when substance use becomes a problem. Here are 4 key signs. First, functionality. Substance use starts to interfere with daily life. You might miss deadlines, underperform, or skip obligations as the substance takes priority. Second, preoccupation. You spend too much time thinking about getting, using, or recovering from the substance. Behaviors like secrecy or lying can happen, but they're symptoms of the illness, not intentional manipulation. These come from shame or fear, so approaching with compassion is key to reducing stigma. Then there's impact on relationships. Substance use strains your connections with loved ones, putting a wedge between you and the people you care about. Lastly, financial strain. Spending on substances takes priority over essentials like rent or groceries. Substance use falls on a spectrum, so it's not always easy to spot when it's a problem. A good way to check is by asking, is this substance negatively affecting my life? If the answer is yes, it may be time to seek support. Recovery from substance use disorder isn't one size fits all. Each person's path is unique, but there are 4 common approaches to treatment. First is medication-assisted treatment. Medications can help reduce withdrawal symptoms and cravings. Family doctors or specialists can prescribe them as part of a comprehensive plan. Next, we have therapy and support programs, which help address underlying causes like trauma or mental health challenges. Group therapy and support meetings, such as Smart Recovery, offer valuable community support. Then there's contingency management, a rewards-based approach that encourages positive behaviors like staying sober by offering small incentives. Lastly, safe detox and medical supervision is essential, especially for substances like alcohol or opioids. Detoxing can be dangerous, so it's important to have medical support during the process. The hopeful news is that our brains are malleable. Neuroplasticity means that with the right treatment, Even established patterns of substance use can be changed, making recovery achievable. Substance use disorder can affect anyone, but with the right treatment and support, recovery is within reach. Recognizing the signs early and seeking help is key. Remember, substance use disorder is a medical condition, not a moral failing. If you or someone you know is struggling, don't hesitate to reach out to a healthcare provider, addiction specialist, or support group. The first step is always the hardest, but it's also the most important. Thank you for watching.